Chris Rohde from Conduit, who manages the Transportation Call Center. Thank you today for our presenters, and I'll turn it over to Alyssa and Chris. Thanks.
Thank you.
Thank you. Good morning, everybody. Again, my name is Chris Rohde. I'm client lead for client relations again. Just to start off on the presentation, next couple slides just kind of go over exactly what we're going to review this morning. First off, we're going to go over just the basic requirements for eligibility. Also per diem for those who are requesting assistance with lodging or overnight stays out of town. Next would be the timeline for how long it normally and should take on a normal circumstance for each and every request. Also emergency travel, what is qualified for emergency travel, what that is defined as, and the process to get reimbursed for that as well. How it all works, just generally how every call from the call itself to reimbursement is processed. Next. Reasons for processing delays. Just most of the most common reasons that we would have to send back the travel requests themselves. And then finally, just some scenarios and examples of each one of the types of travel requests that we do receive. Right, so requirements for eligibility. First of all, the client must be eligible for the date of service itself. Also, the client must be eligible under a covered plan. This is something that per call, first thing we do is always check eligibility, verify the client, or verify that we are speaking with somebody that is authorized on behalf of the client. And also the provider or facility that is enrolled must be active for the date of service. So regarding children's special health, there is an authorization form that we have on file, but this form is only required if the travel itself is outside of Medicaid policy. So I believe you had a few examples of what this could be.
Outside of Medicaid.
Outside of Medicaid. Actually, it was Tracy I spoke with this morning. Something such as
the exceptions to the CSH. So Medicaid, basically, we would cover. Let's see. Within 30 days, you could backdate 30 days to report an appointment. CSH may make the exception to allow 60 days to go back due to circumstances with an infant maybe requiring some additional assistance and the parent not being able to make that appointment or report the appointments to us. They may also do some different exceptions, such as will pay mileage maybe a little bit more frequently for a parent to travel back and forth, maybe between work or another child at another location and back to the hospital.
Okay. Thank you, ma'am. Next up, I did put a chart in for the ones that are eligible for transportation assistance. The only exception to this and the only update since this was created is that ABIW for acquired brain injury, as of April 1st, is no longer an active plan. So regarding per diems, for any overnight assistance, the client does have to be under 21 years of age for the date or dates of service. Mileage for the trip either has to be just in general over 400 miles round trip, or the exception to that is 150 miles round trip if the client does have multiple appointments on consecutive days, or the client is inpatient for 1 or more days. Now, the number of nights in reimbursement that is approved for each client does vary. It depends on certain factors such as consecutive appointment dates, as we discussed before. Inpatient versus outpatient, there are different rates for each of those. lodging providers themselves, and we'll have a slide for that as well coming up, does have to be enrolled for a certain amount of reimbursement, but they can also go to a hotel. A family or friend can take them in for the night, and we would still reimburse with that, just pending proper documentation, which we'll also cover. And of course, the round trip distance for the trips themselves. Our current enrolled lodging providers include Ronald McDonald House of Aurora, and also Brent's Place up in Billings. There are a few that are active with us, but just not an active Medicaid provider, but the clients do tend to stay with them. I can give you an example. Ronald McDonald House in Salt Lake City, we get a lot of folks that do stay over there as well. As for non-enrolled lodging, as I stated, any hotel that is not enrolled. And then the family or friend with whom the client is staying. Now, one thing before we move on, because I wanted to be sure we actually do cover that, the requirements for the lodging for family and friend, thank you. The verification that we need from the family and friend is a letter just stating that the clients themselves, client or clients had stayed with them that night or multiple nights. And it does require an original signature from the person with whom they had stayed. So the timeline for these travel requests. Now, I will state ahead of time, this is on a normal basis. Of course, there's certain exceptions, and we'll go over that as well at a later time during the presentation. But they must be reported prior to or within 30 days after the appointment itself. Once it's reported, the client does have 1 year to return all proper paperwork for processing. Now, you'll hear me say TAC frequently. That stands for Travel Authorization Confirmation. Will be returned by any of our agents or myself if not complete. The appointment verification must have that authentic signature or indicate electronically signed. This brings up quite a few questions from clients when they call in regarding why it was returned. They do ask, what do you mean by electronically signed? If we take a look at the paperwork itself and we can't determine just with the naked eye that it's a pen or even a pencil, if it looks like it's a copy, anything of that nature, we do have to return it just to make sure we have that in order to be able to process. So the provider would need to type on the page itself, this letter has been electronically signed. And that, when we explain that to the clients, that does take care of it 9 times out of 10. Also, we need the verifications for that overnight stay. And in the case of a brand new client or a client who maybe hasn't been reimbursed for quite some time, they're no longer active with the state when it comes to payment, we would need an updated vendor management form and W-9 form. This includes for address changes, name changes, adding direct deposit, removing anything like this, we would need those forms. Now, when it comes to taxis and shuttle requests, the transportation provider, again, must be enrolled for the date of service. We do, for taxis, require a minimum of 24 hours notice. Currently, for just specifically taxi providers, are only enrolled right now is TI Shuttle here in Cheyenne. But when it comes to shuttles, travel may be for in town or out of the area, depending on the situation. And all of our enrolled providers are here. Again, TI Shuttle here in town. Sheridan Minibus, they do go in and out of the area as a shuttle. ARC Regional Services in Laramie, Best Home Health out of Evanston, Wind River Family and Community Health Care out of Arapahoe, and then the Northern Arapahoe Tribal Health. So for airfare, we do offer this depending on the circumstance, and it is required to be pre-approved by the state, and it is purchased by the state. We will go over that process as well. It's within one of our scenarios at the late part of the presentation. Now, as it comes for rental car, there is no assistance, and we don't actually provide reimbursement for any rental car services. As for emergency travel, clients may be eligible regardless of children's special health enrollment. The specifications for this type of funding, it must be limit one request per 30 days per client. For the emergency travel itself, the criteria, we actually do contact the provider when we receive this request as well. Provider must again be enrolled and active. The reimbursement does have to total $100 or more. And the appointment is then verified once we receive the request with the provider to make sure that it is considered an emergency appointment, that this wasn't something that was known about or set up weeks or months in advance. Now, if we do receive these calls and it is approved, what happens is that if we send off the information, the check is sent to the public health nurse in that area for the client in question, and the public health nurse gets that check to the client or guardian. Now, I did put this in just to note specifically for children's special health that if the requested travel doesn't meet guidelines and they are eligible for children's special health, they would be suggested to contact their public health nurse to request approval from children's special health, because this is something that I believe children's special health can actually override in individual circumstances. Now, as for the meat and potatoes of how we do everything and how the magic goes, client calls in. We first verify everything and make sure that we pass all verifications, etc. And once we know that they are requesting transportation, we enter it into this program as you see it there. As you see, no problem. As you see on top, this is how we kind of search for everything. New TAC on the side there. And if we're looking somebody up that has an existing travel request, we can assist them with that if they're canceling a trip or changing times, anything like that. We do request per client that if they have any changes, that they call them in either before or right after they occur, just so we can line up all of our records with what they have. So it also would prevent and lower the time for processing. On the right, you will see this is our form, the TAC itself. This is what's sent out to the client once a week on Thursdays. Has that TAC confirmation. Also with this, they receive in every envelope an instruction sheet for exactly what they need. If they have any questions, we do advise, don't hesitate to call us. If there's no dumb question, we're more than happy to help. And for new clients or those who are applicable, we do include also the vendor management form and W-9. Once the client returns all the documentation with all of our call center agents, as well as myself if necessary, they are processed for payment within 2 business days of receipt. And then I myself QA them and send them for payment within 30 days. Now, as it goes for the 30-day mark, that is the maximum. When it comes down to it, we strive to make this as quick a procedure for the client as well as we can. At this time, normally it does take no more than 1 to 2 weeks from the date that we get everything. So we've worked to kind of streamline this process and make it as convenient for everybody as we can. Also, we have been trying to incorporate a lot more references to the web portal. As we know, not everybody has access to the internet, but for those that do, I myself received a call from somebody yesterday who wanted to use the web portal to request travel, so I walked them through that process. On the web portal, that's a screenshot of when they do sign in for it and sign up. You are able to request transportation reimbursement only for private car use. If you yourself are driving or if a friend or family member
is driving you. If it's for a taxi, for airline assistance, anything of that sort, taxi shuttle, that is something that you would need to call, or the client would need to call in to request. As it goes for online requests themselves, they can log in and check the status of that request. Also, they can access our transportation assistance manual, which is also available in Spanish. And as you can see, there are other self-service options. They can order themselves their own ID card. There's that Ask Wyoming Medicaid inquiry. When they send that in, it comes directly to myself, and I believe 1 or 2 other people that would get it over to me. And that's a quick process as well. So do we try to get that out and get the word out? There's last 2 months, we actually created a flyer that was going out with every travel request that said, kind of corny, good news, and told them where exactly the web portal was located and exactly how to access it. So here is one of the questions we received was that there was a lot of folks that had complaints or had concerns about the length of time that it took for their request to process. These are the main reasons that we have to send anything back. The travel request itself isn't signed or dated. One thing we try to do is, some folks may be hard of not able to see well, so we highlight the signature and date portions of the TAC itself, just trying to make it easier. Appointment verifications, lodging receipts may be missing. This can happen a lot if there are multiple trips that are included on one travel request. So if we do receive these once or twice and they are having to be returned, at that point we will call the client and let them know, hey, we've seen this has gone back a few times. Let me take time, let's go through this, make sure that we have everything that we need. That way when you get it back, we're good to go. The verifications, again, that's electronically signed. That is one of the major ones that maybe create any, I'm not going to say complaint, but just concerns or frustration from the clients themselves. And then the vendor management forms and W-9s. We try, because a lot of people may not be used to these forms, before sending them out, we will highlight every part that they need to actually complete. And that includes if they're signing up for direct deposits, things like that. That way, when we get it back, we can get this done as quick as possible and go from there. I do want to highlight also another question that we had, and this is regarding delays as well. A lot of the time, it's the newer clients with their vendor management forms and W-9. When we receive that, the process is, once they are complete for what we need, we forward them to the state auditor's office for processing. We do advise that these forms can take anywhere from 30 to 45 days to process. In all actuality, at this point, it just depends on the day. It can take a little longer. It can take up to 90 days at this point. I try to get the agents and myself to give as much empathy as possible, because I know it's really hard to wait. But at that time, it's sort of a waiting game for us even. So I myself check these at least 3 times a week. I tend to be sort of OCD about it. And then once we receive these, especially for the clients that have been waiting extraordinary amount of time, I will call them and say, we got these uploaded. We're going to have these processed for you this next week. So at least that they know. So when it comes to examples, this first one here, client happens to be 45, just driving to an appointment from Douglas to Casper. He is on a full coverage plan, eligible for travel, provider's active, everything's been verified and checked. So what we do is submit the travel request and process just as normal once we receive all proper documentation. This is a perfect circumstance. Does this happen every day? Of course not, but we're working on it. Example 2, so client is 15. He is eligible, he or she, pardon me, is eligible under a current plan. The appointment itself took place On March 3rd, they called to request the reimbursement as of May 26th. In this example, they called a little bit past 2 months after the appointment itself. Unfortunately, we would not be able to process that request. And again, at this point, if this was to occur, we would educate the client, say this is the proper timeline for this. Next time you have this, please give us a call, give them the number. 9 times out of 10, they take that information, are educated, and they can give us a call. I'm more than happy to help. So the third example, client is 15, of course, under eligible plan. They live in Basin, and they have been advised that they need medically necessary surgery in Aurora at Children's. Parents happen to not have a reliable vehicle in order to get there, no family, no friends that can assist. And so they are requesting airfare for this procedure. In this case, this is for airline requests. For these, we do require, first off, that we receive a letter of medical necessity from the provider. This letter explains, one, that of course that the surgery is required and necessary, and as well that the reason why they are not able to travel to the appointment with any other means. Once we receive this, our call center gathers all the information. It's sent to myself, and I send it over to Amy Buxton or to Cherie Null if Amy is not available. Once it is approved, they are usually really, really good about turnover, business day or two, honestly. State purchases tickets, they get the information over to me, and I contact both the client's parents, and the provider as well, just to make sure that everybody is aware when travel will take place, when they will arrive, this sort of thing. And of course, any lodging is approved, but it's on per case basis. Fourth here, the client is an adult. They live in Sheridan, and they have dialysis 3 days a week locally. Again, does not have reliable transportation even around town. In this case, this would go over to Sheridan Minibus. I myself contact Gallup Sheridan Minibus once a week to confirm all appointments, just so they have everything that we have in our system. So there's no hiccups, there's nobody that misses anything. So we have that streamlined as well. The client must have the provider's name and address available, and I must stress again, provider must be active for the data service as well. Once we enter all the information for the request, we give the travel request number, 5-digit number, to the client. From there, they would call Sheridan Minibus to give them that number, and that's for their billing purposes at that point. So number 5, client lives here in Cheyenne, has an appointment downtown, needs a ride to and from, no reliable transportation. So here is where awesome TI shuttle comes into play. Again, client must have the provider name and address available at the time of the call, and they must give us 24-hour notice. Are there exceptions? Of course, if a client isn't aware, this goes for Sheridan Minibus as well. If the client isn't aware of the process for travel, they've never done it before, we will allow it because we want them to be able to get to their appointments on time, as it is for them. But usually on a daily basis, it's 4:30 p.m. that we request that clients call in for anything the next day. At that time, I myself contact TI Shuttle twice a day to report taxis that we've received and confirm all appointments, all pickup times, everything, and make sure that they are good to go. And then finally here we have all of the numbers that anybody needs to contact us or anybody related to Medicaid. Client relations on top and transportation services, I believe those both numbers actually will reach us. And that's for travel requests, checking eligibility, any general questions, give us a call, more than happy to help. Third number down is for the eligibility department or customer service center. That's for enrollment, checking their enrollment status, anything of the like. And I included the provider relations number just in case there was a scenario where client calls in, maybe the provider was not aware that clients can actually access a prior authorization, something like that. That's where we inform the client, give your provider a call, let them know this is something that they would actually call into. If they don't have the number, here it is. That way they can call in and get this taken care of for you. And last but not least, that was our website up there. And there we are. So at this point, I have taken a look at questions that we received prior to the presentation. Kind of wanted to I guess, go over these for which ones have been covered or not. Was there anybody in the room there that had any specific questions that maybe wasn't answered during the presentation?
Paula, do you want to pull up the chat box? There's a couple of questions.
Oh, perfect.
So if you want to read the question out loud,
Okay.
there's the one, the one we thought you had said the round trip had to be 400 miles. How does it work when they're eligible to go from Douglas to Casper? I think they're talking, your 400 miles was for per diem.
Right.
For lodging.
Lodging is 400
So
miles. If even if the client is, I'll give you an example locally. If they're going from Cheyenne for some reason, have to go to Pine Bluffs. If they're eligible just for the appointment, but the appointment is located in Pine Bluffs, then they're still eligible for that travel. And how that works is it's 26 cents a mile round trip, or one way depending on the situation. But yes, they would still be qualified for that. For mileage. Next one I have, if you cover airfare, how does that work with emergency services when the child needs immediate healthcare services? So I guess I haven't actually had that situation. We've only had a few emergency travels. I think Amy Buxton is going to come over and answer that one.
So normally, air travel requires at least a 2-week window, just because if you've ever purchased airline tickets, if you purchase at the last minute, the rates usually go up significantly. If there was some kind of a emergency situation, then you would still contact the travel call center and they would contact me and we would work together. We have had 1 or 2 situations where, excuse me, the parent actually ended up purchasing airline tickets and requesting reimbursement from the state. That is not how we want things to work, but if something comes up on a weekend and the child has to go somewhere in an emergency, we have a client whose case is being followed by doctors in California, and their local pediatrician was the one who said, I can't handle this, you need to go to your people in California. It's going to require that the physician locally be the one to have said this has to go now. So it's a rare circumstance that it could be covered, but unfortunately that would require the family to purchase the tickets and get reimbursed. Obviously, if it's on a weekend or emergency notice like that, we'll have to work with it after the fact.
Thank you, Amy. Next question we have, I apologize, I'm half blind some days.
Can you make it bigger?
How do we go
There you
about
go.
getting?
Oh, okay.
Well, I'm sorry.
The 4 little arrows in the top.
Then if you can go to,
There we go.
there we go.
That didn't work.
Sorry.
No problem, no problem. How do we go about getting a source of transportation in our community approved through CSH? This is for Rock Springs, and I'm thinking of Starbus. I am not sure if Starbus possibly might have been the call that I received yesterday, but I randomly, you have a really good timed question, had somebody call in because they want to become a transportation provider. how I had recommended they proceed, number one, online on the web portal under provider does give the enrollment instructions. There are tutorials for this procedure as well. When it comes to transportation, though, I found out recently from one of the awesome gals I work with that specifically for a transportation taxonomy that they work under, they would be required to have the specific business license that's required for that. And, you know, coverage, insurance, everything, it goes a little bit more obviously toward them than a provider enrollment. But that would all go through if they had any specific questions, provider relations, and that's where that number ending in 1268 would come into play.
And this is Amy. Basically, for a transportation provider, if you're not a licensed taxi, we have the non-taxi ride provider option. The entity does have to be a business entity. I, as a person, cannot enroll as a non-taxi ride provider, just, you know, out there tooling around, picking people up and moving them around. I don't have the licensure, I don't have the regulation, I don't have the insurance necessary for that. At that point, it becomes a regular reimbursement, and you could go through the travel and do that normally. But as a business, so you can be an offshoot of an actual business. We have several tribal providers that are part of the health programs there. You can be part of a senior center. You can be part of a home health agency. You can be part of a clinic. Anything that has, you know, regulated transportation business licensure can do non-taxi ride provider services. So if you have the ability to do that type of transportation, you're welcome to enroll as a provider. There's a flat reimbursement plus mileage process. It's all explained in the provider manual, so I would recommend you check that out and look at the transportation chapter. But basically right now, it's a flat $10 fee for the first 15 miles round trip, and then 26 cents a mile if you go further than that. So if you're taking people out of town, you know, that can add up in a hurry. If you're just driving around town, then the $10, that flat fee covers 15 miles. Sorry, not round trip, each way. So yeah, it's a great idea, and we would love to have more providers. There is actually a second taxi that's enrolled in Gillette, but nobody's ever used it. So yeah, that would be cool too.
Even I didn't know that.
Yeah, nobody's ever used them.
There was emergency travel funds available a few years back on an individual basis. Is that ever going to be available again?
So emergency travel has been brought back with the same policies that it was before. We just handled the checking account differently. So you still would request it from the travel center, and if it fits the guidelines, the check is cut here at the state office and it's sent to the public health nurse to distribute to the family.
All right, the next question is, what's the reasoning behind acquired brain injury no longer being covered, and does this include non-accidental traumatic brain injuries? Just to clarify, the Developmental Disabilities Waiver Program used to have 3 waivers: ABI, Children's DD, and Adult D. They've restructured everything, so now everyone is either on the supports waiver or the comprehensive waiver. It's not that coverage went away, it's that the actual program went away. So all of those clients who were previously on the ABI waiver have now been transitioned over to either the supports or the comp waiver, and transportation is still covered under both of those.
Next week, we'll cover the waivers in more detail.
Requires authorized signature. Yeah. So the next question is, what is the reasoning behind needing the original signature? I've had clients that have received numerous denials even if they have the original signatures. They have been told that an electronic signature would not work. That's part of it. So the issue is, unfortunately, fraud. It really comes down to fraud. We have had a few clients who are actually good enough with their computers to fake authorizations and fake verifications. It's just like the rest of the documents that are used. The SAO will not accept a non-original signature on the vendor management forms. Enrollments have to be signed as original signatures. It just really, unfortunately, comes down to fraud. Copies and faxes and everything else, you know, you can't say that this provider signed this version right now for this. People are too smart So the original signature is necessary. If they are getting original signatures that don't look original, that can cause a problem. And recommendation is that they ask the provider to sign in an alternate ink color. Use a blue pen. It makes it really obvious that it's a signature. And the electronic signatures, the document has to be verified that it's electronic. It can't just look electronic, or it can't just be electronic and somebody says so. It all comes down to verification of fraud and prevention of fraud, unfortunately.
And again, if I could add into that, I see on one of the questions, are you aware of any complaints, and is there something that clients are misunderstanding? Definitely, we are aware. I took over as the client lead. Actually, it was created, this position last May or June, and since then, one of the major, missions has been to tackle efficiency, to tackle lowering any complaints, any lasting stigma, if you will, about this program that people may have from the past. It's something that's here obviously to help, and we don't want any clients to think, I'm not even going to bother with this because it's not worth my time and it's not worth the hassle. I already have to go to the hospital 3 times a week. That's not what we want. So anytime we hear any complaints or anytime we hear any concerns of anything of that nature, we take them and we work with them, and we fix it. And that's something we've been trying to do for quite some time. So it's definitely gotten better, I would hope. Let us know if we don't. We'll make it.
Yeah, there was a second half to the previous question. It says, for our high-risk maternal client and or newborn intensive care babies that are being sent to Denver, should they be applying for emergency travel so their family, the mom of the newborn, can get to Denver? And that's really going to depend on the situation. Most of the time, the program is set up as a reimbursement program, but if there is a reason or a financial stricture that they can't do that, then yeah, they can contact and ask for emergency. Obviously, a delivered baby, you can't plan ahead for that. So that would be an emergency situation. And if it meets all the other qualifications, it could be done that way.
I've had several.
How do you access the web portal?
And I apologize, I was kind of
Jumping.
jumping from one of the questions that Amy had answered. On the previous question, I think from Lori, clients had complained about their paperwork being lost at the travel center, and they were told they had to resubmit the paperwork, which they need to go back to the providers to get. I agree, it's incredibly stressful, and although it has lowered the amount of times we have these to almost nothing, it's a horrible call to have to take.
Do we have any specifics regarding those scenarios? Because essentially our process is our mail comes in, it's stamped, it's handed out, it's all put in the database, check and balance. So I guess it kind of comes down to when we're hearing these complaints, especially calling into the call center and getting different answers when asking questions, we need specifics if possible. What situations are these clients enduring, as far as did they speak to someone and were told their paperwork was lost, misplaced? And if so, if that information can get to Chris, if that client calls in and is told, Chris is the lead and can handle those escalation situations.
And of course, we're dealing with the U.S. postal system. I'm sure we've all had cases of mailing something that did not get where it was intended to go. So it's not always a case of, the call center got it and then misplaced it. It's a case that mail sometimes just doesn't get where it's going, and that's unfortunate.
How do you access?
How do you access the web portal? So on the last slide on the presentation, if we need to, I can name that off for you for the
No, it's just the Medicaid website.
Just the Medicaid website. You want to
Client.
choose client, and then on the left there will be an option for client web portal. From there, there's a web registration option. I believe what you need is the client ID, first and last name, social, and date of birth to register. And then from there, just take your user ID and password, and that's how you'd be able to access that. Also the client handbook, which you can access online without even logging in. Is there a main contact under CSH that we could call to get the correct answers on the first call? It seems when we or the family calls, they are given a different answer from each person that answers the phone.
So I think you're meaning there's only one transportation call center. It doesn't matter if it's a Medicaid client, a CSH client, or a dual client. They just call the one transportation call center. And I think Alyssa answered that question on if you have problems, you can call Chris or ask for Chris.
Yep. Yep, and all our calls are recorded. So again, if you have specific scenarios, all calls are recorded. We coach as necessary. We work with our agents. We have 3 client agents that take calls daily. So if you have specific examples, let us know. But all calls are recorded for accuracy.
So the next question is, what if they are not on a waiver? Getting on the waiver can be a very lengthy process. So our next session will cover the waiver. So hold that question for the next presentation.
It is not the client.
It's not the client, it is the PHN nurses. All 4 of us have called at various times to get a client on this service. Each time we call, we get a different answer for the same scenario. I guess I apologize, but what scenario?
When you say all 4 of you are calling in, and what scenario? What?
Mona, did you want to unmute your phone and answer specific scenario?
And just as a side note, if you're ever unsure about the answer, or it doesn't sound right, you can always ask to talk to the supervisor, ask to talk to Chris and get clarification. And maybe, you know, your different answers may be a matter of how you word the question, the client in question, specific circumstances. I mean, changing, you know as well as I do, if you change one word in a question, the answer can change. So, you know, each individual case is different. There's a standard process, but the specifics can change it. So without specifics, it's very hard to address any potential inconsistencies you're getting.
Right, and I would like to add to that as well. Again, since Chris has overseeing the transportation and the client's call center, a lot of the inconsistencies have gone away. So are the concerns more current, or are they from the past? So again, like he mentioned during the presentation, that he's really working on eliminating those issues from the past. So hopefully some of these have gotten better. But the PHNs, if you're calling and you're getting a different answer or you're not sure, please escalate that at the time of the call. Don't get frustrated and keep calling back, or have your other nurse in the same facility call back and see if you get the same answer. Ask to speak to the supervisor, which is Chris at that point.
Can you guys hear me?
Yes.
Yes.
Okay, this is Mona. So when we call to try and get transportation for our moms who have to go down to see their kiddos and are staying at Ronald McDonald House for travel reimbursement, one person will tell us that it's not covered, and then we call back and talk to somebody else, and they say, on the same scenario for a different client, and they say it's covered. So there's no consistency happening across the board with our clients.
Is this recent?
Yes, this was within the past month.
Okay.
So basically, when it comes down to the mom going down to visit their child in the hospital, there's a few different things that can happen. So we have had instances where the parent will go down and stay with their child in the hospital, but may need to go back home to deal with other things going on, check in, things like that. It's going to be kind of a basis scenario as far as what we're going to cover the back and forth. We're not going to pay mileage reimbursement to go down, stay with the child, but then have to go back home for the weekend because they need rest, then pay to go back down to see the child. I mean, we have to have that verification of what they're doing. So, you know, we've had different scenarios, but we are going to cover that transportation mileage to go down, stay with the child. We would cover reimbursement either staying in the hospital, Ronald McDonald House, a hotel. But again, if they decide to leave and go back home without the child in hand, we need to know what is occurring. Are they going back to do maybe a checkup for themselves because they had given birth and it's back to their OBGYN and then have to go back? Where then we'll cover that. But if it's, again, just to go back home to let the dogs out and clean up and then return, we're not going to cover all that mileage with the baby not in hand.
So Mona, so that's where the maternal, the newborn intensive care comes in. We will cover additional trips for the mom to bond with the baby to go down there, but we do have a limit of 1 trip a week with a cap of $2,000 for the time that the newborn is at the level 3. But you do have to go through the transportation call center, because we want to, if Medicaid will cover, if it fits Medicaid guidelines, we want Medicaid to cover it. And then if they deny it and it doesn't fit, then we look to see if it fits under the newborn intensive care program.
Thank you.
Those, they're going to, so with those, Mona, to me, you're going to start the initial appointments or the initial stay with the client or with the transportation call center. To the exceptions to travel back and forth the number of times, you're going to contact CSH, who will provide us the direction.
Well, Ronald McDonald requires them to stay at that house every night. So they can't travel back and forth, only for like to come back to take care of appointment stuff, or, you know, if they've just delivered, they're having their postpartum follow-ups. And this was one scenario that I called on, and the person I talked to the first time said they would not cover that because she needed to be down there and she needed to stay down there. And then I called back the next week and for a different client and got a different answer. So there's really no consistency with.
Again, Mona, I would talk to Chris, but truly, if you look at the guideline that's on the website, we're not going to cover the back and forth. Probably what happened is we contacted Amy, got the exception for the one client to go back and forth for the medical appointment and then back. And so then the call center understood that, oh, we can probably get this next one approved, and took the request and forwarded it to Amy.
But definitely escalate to Chris if you have that situation where you feel one's getting approved and one's denied. Because again, depending on the situation, depending on the wording, depending on the plans, that it's all factors that are going to play a part.
Because those are, and just to clarify, because those are exceptions to the Medicaid policy.
Mhm.
Yes. So the one complaint regarding paperwork at the bottom there. So one complaint we have, we submit the paperwork, keep copies, and the client receives a letter stating they are missing something when we have submitted from your own office. So I will let you know, one process Chris has implemented is every time they return something back to the client, everything is scanned in so that when they're calling in to see what was missing or what is the issue per se, they can speak to everything they received in hand. So I can't say, I mean, again, we're dealing with postal service, you know, everything's getting checked in. If they have small doctor's notes, so say it's a doctor's pad and it's just that little piece of paper, anything is possible. The big sheets of paper that are easy to fold and keep together and everything is going to make it a smoother process. But we are scanning everything that is returned back to clients in so we can see everything that was received on the initial check-in.
Mm-hmm. And also then going forward, contact Chris. If you're saying that you sent them from your office and you can validate that information and what was sent, have that conversation with Chris.
You can ask for me directly. It's not a problem at all. If you've already called in once, don't, you know, increase frustration on yourself. Just get a hold of me and I'm more than happy to help and get that checked out.
Yep. And if he's unavailable, again, my name's Alyssa. I'm there as well.
And just a side tip with Alyssa talking about the small pieces of paper, it's a really good idea just to tape those with clear tape onto a regular sheet of paper. That helps avoid them getting lost, makes it easier to scan, easier to document.
Who are the speakers for this call? Can you provide contact information?
You want to our direct information isn't on there. So again, my name's.
And again, I would just So you don't have to remember any other numbers. Contact the 800 numbers, and you can ask to speak with Chris. He's the only Chris in the call center. Alyssa is the only Alyssa in the call center. And then if you're not satisfied with them, you can always contact me, and that is Tracy, and my last name is Fulton, Fulton. But you can just call the 800 numbers if that's provider or client, and ask to speak to one of us.
And this is Amy Buxton. If you have gone through all of those steps and you still, are not satisfied with what's going on, you can contact me. I would request that your communication be by email, because it is better for me to have everything documented in writing. That avoids any miscommunication or misunderstanding or misremembering from a telephone call on my part. So you can send it to me by email, standard state email, amy.buxton@wyo.gov.
All right. Were there any other questions, concerns?
I did real fast. There were a few that we had gotten sent in. So one I wanted to touch on as far as if the client is receiving assistance elsewhere. So say, for instance, their church is assisting them with their travel. Basically, what we will do is we will document that, the amount they're receiving, who they're receiving it from, and then we will work with Amy to determine if Medicaid's refunds would be smaller or if it would impact it whatsoever. We did touch on what kind of visits are covered, medically necessary and active enrolled providers. There is no number as far as how many the client can go to, so there's no limit on that. There was a question, why can PHNs not get a copy of blank travel forms when requested? We actually don't have any blank forms, so everything's created in our transportation database. Therefore, that information is printed every Thursday and sent to the client. So there's nothing blank we're able to provide. And then I think that was it.
And I
There's
believe,
there's a new question on that.
so for our families that have given up on the travel process, do you have some suggestions on scripting, what to say to them to have them try the process again?
Give us another
An
shot.
exit, yeah, give us a scenario. If you can give us a contact. I myself have contacted folks who have said, cancel my travel request. I give up. I'm done. And I've said, got your red flag, your white flag of surrender. Let's help this. Let me help you out, and we get them paid. Have them get a hold of us. Have them get a hold of me if they have questions as to what exactly needs to go through. I will take the time to go through the whole process. It's not a problem.
And on the last slide of the presentation is all the phone numbers for transportation, client relations, and that's where you can reach all of us. And it's got our Medicaid website as well. We will be placing this presentation on the Medicaid website under the provider side in presentations for 2018, so you can access it at any point in time.
Hi, Chris. This is Heidi. I'm a nurse up in Casper. Can you hear me?
Yep, I can hear you. How are you?
Good, thank you. So I was the one that actually typed in the last comment regarding the families that have given up on the process. So
okay.
These are families that have been children's special health families that have been with us for at least 10 years or more. And I'm just wondering, what are some things that you want us to tell them that has changed? Because they've given up years ago and they're just not even worth, they have legitimately said, this is not worth my time. It's too much of a process. Every single time I try and send something in, it was denied. So we've just given up. So what is something that I can say to them that has changed to make this process better?
So first of all, I would say this entire process has completely been redone from start to finish. I took every little piece of it. It took a little bit because my previous job I worked for was Verizon. So coming from Verizon to insurance, it's a little different. But I took a lot of that customer service that I had and applied it to this entire program. Communication was a huge factor from not only the clients themselves, but all of us in the call center, myself included. Let them know that the timing has been completely improved. The efficiency for when we return, every portion of this program has completely changed. If they have any questions on that, if they have any specific concerns, give them our number. Even if they're not specifically, calling in a travel request, if they just want to talk about it, I'm here. I'm more than happy to help. Yeah, because the more people that know about this that either haven't known or have given up, it's kind of what it's here for. So, yeah, lay 'em on me. I'm ready.
Thank you.
You're very welcome.
So do we have any more questions? We'll conclude this session. So thanks for joining us. Thanks to the presenters today. This was very informative. And our next session will be covering the Medicaid waivers. Thank you. Bye.
Thank you.